A very good evening to everyone. Welcome to today's session on ADHD in children. And to speak on the topic today, we would like to welcome Dr. Prachi, who is our in-house consultant for neonatology and pediatrics. She has done her MBBS, DHC, and developmental pediatric. We welcome you, Doctor. You can now take over the session.
Okay, thank you for introduction. So, hello, good evening, good afternoon, everybody. I am Dr. Prachi Bhosle, working as senior pediatrician and neonatologist in Apollo Cradle Hospital. So, today I would like to discuss a very important topic again, which is again many parents have asked me about this topic. So, I would like to discuss about ADHD. Okay, so what is ADHD? It is attention deficit hyperactivity disorder. Okay, so normally we are seeing in attention deficit, like babies are many times very active, they are very hyperactive. Parents will be asking that my baby is not staying at one place, he's just continuously keep on moving around here and there, he's not listening to me. When they are 3 years, 4 years, whenever they come for vaccination, they are asking us the doubts. Does my baby has ADHD? Does my baby has any problem with his speech? Does my baby has any problem with his behavior? Is it normal behavior, or else we have to have some consultation with the developmental pediatrician, or else do we have to refer to somewhere where we can take help for the doctors, so that our baby can help. So all these questions I would like to discuss. What is ADHD? What are the risk factors? What are the causes? What are the types of ADHD? And how we have to treat the ADHD? And not do we have to consider those babies who have those kind of symptoms, all the babies ADHD, or there are some other symptoms also? So we will discuss one by one. So what is ADHD? So as I told you, attention deficit hyperactivity disorder. So in that disorder, we should, as I told you, we should know it, because if you diagnose it as early as possible, we can also start the treatment also early, so that the kids or the child will be out of his out of his symptoms and signs, and his life will be much more better to survive. So, what is the definition of ADHD? So, it is the neurodevelopmental disorder. So, we have to understand that it is a chronic disorder, and that too neurodevelopmental disorders, which is marked by ongoing pattern of inattention, hyperactivity, and impulsivity. So, there are three factors of this ADHD: inattention, hyperactivity, and impulsivity. So, that normally interferes with the baby's function and development. That is very important to remember, that if it is not interfering with baby's normal life or functioning or learning, then it is not called as ADHD. So we have to differentiate. So I will just discuss how to differentiate that. So it is a disorder that makes it difficult for a child to pay attention and control the impulsive behavior. Baby is always restless. He is not stable at one place, and he is almost constantly active. That is the normal complaint which the parents will be telling us. It is highly prevalent condition. So the number of cases which we see, like the number of kids which are referred to me for behavioral problems, out of that 50% babies are ADHD. So the children, normally it is present, the males to female ratio is 3:1. So normally boys are more affected than the girls. And the symptoms wise also, in the males the symptoms will be different, and in the females will be quietly inattentive, and the boys will be hyperactive. So we have to see the difference also in the kids, and it is also seen higher in school going children. So now, why it happens? The causes. So the causes are, like as I told you, it can be hereditary. It is highly hereditary. Like it can run into the families. If the mother is having, or maternal uncle, or else grandmother or grandfather, or else if any history of infection, history of ADHD is there in the family, it can be seen. Like in the twins also, it can be there. So it is highly heritable, genetical, as I say, as I call it as a genetics. The genetics are really important in ADHD. We don't know the particular gene, but yes, it is seen in families. So the genes is very much important. The other one is cigarette smoking during the pregnancy, and alcohol use during the pregnancy. It is shown that it is very highly prevalent in those cases. Hello? Yeah. So environmental toxin, as I told you, the lead exposure can cause ADHD. The low birth weight babies or else the premature babies also can have ADHD. The brain injury during the delivery is again the cause of ADHD. The environmental factors other than all this are like severe marital discord, low socioeconomic class, large family size, or is paternal criminality, and maternal mental disorders. If the mother is having some depression or his mother is having some um, anxiety disorder, it can cause ADHD. So the then the what are the types of primary types of ADHD? So as I told you, there are three subtypes: inattentive, hyperactive, and impulsive. So predominantly inattentive is normally 44%, in which normally babies will be disorganized. They can't keep their things organized properly. They have a lack of focus, difficulty in attention, difficulty in attention. They have difficulty in staging the things. Then they have difficulty and they can't talk on the topic for long. Whichever takes time for long, they can't talk on that. Then the other thing, hyperactivity. Normally they'll be fidgeting or squirms when they are sitting. They get up frequently from this when it is compulsory sitting is ex- uh, accepted or else it is required to sit for a long time, they will be continuously moving around and they have trouble playing quietly. And they also have the second one is either hyperactive or else inattentive, which is 43%, in which the babies will be more impatient. They have hard time waiting to talk, and they will be blurting out the answer before the question is not even being completed. So the other last type is combined. So one is inattentive, which is 44%, then hyperactive or is impulsive, which is 43%, and then combined one, which will be 13%. So the normally we stage the criterias of this one according to DSM-5 criteria, like the Diagnostic and Statistical Manual of Mental Disorder. In that, normally we discuss all this. Uh, uh, According to that, we normally have some symptoms. So, what are those symptoms? So, I would like to discuss those symptoms that normally inattention. What are those symptoms in inattention? So normally babies will fail to give close attention to the details or makes careless mistakes. That is very important thing to the in the schoolwork or workplace or wherever in the normal activities. The baby has trouble holding the attention or task or play activities. He does not seem to listen when spoken directly. He'll be like overlooking, or else he will just try to avoid the discussion. He does not follow through on the instructions or fails to finish the schoolwork or normal chores or the duties in the normal day-to-day life. Those activities are sidetracked. Often he has trouble organizing the tasks and activities. Often he avoids the or he dislikes or he is very reluctant to the tasks that require mental effort for a longer period of time. This is very again important. And he loses the things many times. And the tasks or activities, like normally once he comes from school, parents will be saying he will be missing his pencil, rubber, or eyeglasses sometimes, or is normally keys, wallets. Normally they will be always forgetting their day-to-day activities, things which are very important in the day, everyday activity. Then he is often distracted. Then the other thing is hyperactivity and impulsivity. In that also there are the DSM-5 has given the 9 criteria. So in that again, as I told you, the child will be fidgeting over the tap, over fidgeting, or he will be tapping on the hands or feet, or he spawns on the seats. Then he often leaves the seat in situated where the remaining seat is expected. That is very important, which I told you again. The baby will be running around or climbing the situation where it is not appropriate. often he's able to play or take part in leisure activity. He can't take part in the leisure activity which has to be done in a quiet way. He often on the go. Parents will be always saying he's on the go. Like there is some machine in his legs and he keeps on running around continuously. Like he's driven by motor. That is the exactly same words which normally parents will be using. The baby is running like he's driven like a motor. He often talks excessively and he blurts out the answer. As I told you, before the question is completed, he will just blurting out the answer. He has trouble waiting for his turn and he'll be interrupting or intruding the others. Like if that all some conversation is going on, he'll be in between, again in between, introducing or interrupting the other people in between their conversation. So these are the types out of this. So if at all any parents are coming to me, so normally how we diagnose that all the babies are having this symptom. Normally many babies will be running around, as I told you, at 3 years, 4 years, they will be hyperactive and all. But do you think that all these babies are having ADHD? So my answer is no. All those babies are not hyperactive. We have to do the thorough examination. We have to get the proper clinical history from the parents, from the family members, and from the school teachers. So we have to do the detailed examination and then we have to do the proper diagnosis. And to diagnose also we have some criteria. So out of the what are those criteria? So as I told you, out of these nine symptoms, at least kids should have from 14 to 17 years of age, at least the baby should have more than 6 or more symptoms, whatever I have discussed right now. More than 17 years, they can have 5 or more symptoms. And those symptoms should occur in two or more settings. Like it can occur anytime in the family, at home, or is in the school, or is at the playground, or in social gathering or anything. So if it is happening more than 2 times, then we can just call it as a ADHD. Then the symptom should start as early as before the 12 years of age, and it should continue. It should not just have happen only once. It should continue for more than 6 months. This is very, very important, and it should not be explained by any other mental disorder, because there are many other mental disorders like we can consider it like some tic disorders, anxiety disorders, mood disorders, learning disorders, or else aged autism spectrum disorder per se. These disorders or sleep disorders, these disorders we have to differentiate in all these things. So then only we can just go on to the diagnosis. And the symptoms impair the child's ability to function in daily activities like schoolwork, and it affects the baby's relationship with the parents, with the siblings, and with his friends. So the important thing is over here is I would like to tell you that there should be impairment of functioning and learning. This is a very important. If there is no impairment, baby is not. If the parents are saying he is active, but he is doing his work or homework and properly at on time, and he is performing well at school, we don't have to consider this as ADHD. So there should be some impairment. Then only we can consider it as a ADHD. The other thing I would like to discuss that ADHD normally causes impact on the baby's life. So what are those impact normally? Because not baby, maybe we can consider as a child or kid. Okay, so because normally we can diagnose it from the age of 4 to 12 years anytime they can have these symptoms. So for it's not like that only small babies. If it is less than 3 years, it is not ADHD. We don't call it as ADHD. It can be some overreactivity or its tantrums from age of AAP guidelines, like American Association of Pediatrics. They have told that initially the guidelines were above the age of 7 years, but now they have changed the guidelines from 4 years. So any kid who is having those kind of symptoms above the age of 4 years till 17 years, we can just differentiate them and we have to diagnose that as an ADHD. So what is the impact on life? So that is also a very important thing, because if, as I told you, it impairs the functioning and the learning disabilities. Okay, so it causes the academic limitation, as I told you, because the kid will not be sitting at the same time. They will, parents will be also complaining that the baby is not sitting even during we are telling the story. Actually, telling the story time is very good time when the kid will be sitting at the time and they'll be very more interested in listening to the story, even though he's not interested in the studies. But in ADHD kid, they will not be sitting at one place. They will be continuously on the go. They keep on running around, and their mind will be distracted. One time they will do one activity, another time they will do some another activity. Within just a matter of minutes, they keep on changing the activity. So normally it will be seen that one, so that they will have the academic limitations. They will have difficulty in maintaining the relationship, as I told you, with the friends, or else family, with family members also, or else in the school friends also. They will have, because they are not in a relationship, the kids will be having low self-esteem, which can prone slowly, and because they are very hyperactive, which can prone for injuries. Okay, so slowly they can have motor vehicle accidents if it persists in the puberty or else adulthood. They are prone to motor vehicle accident. They can have some legal difficulties and professional problems. So these are the impact of ADHD, which happens in the normal baby's life. So or else kids life. And sometimes, as I told you, so there we have to rule out some coexisting condition, which, as I told you, oppositional defined disorder, or else conduct disorder, or else mood disorders, anxiety disorders, tic disorders, epilepsy, or else learning disabilities. So we have to rule out the other disorders, so that we can just go on to the diagnosis of ADHD. So now the most important thing I would like to discuss is the how to manage. So the management is very important once you make the diagnosis from DSM-5 criteria. So the diagnosis can be medication and the behavioral management. So because it is a chronic condition, as I told you, we have to educate and involve the patient's family and the teachers regarding the diagnosis, and we have to set a goal. We can't directly reach to the immediately on the diagnosis last point of the treatment. We have to go slowly, because we have to attain the goals very slowly. Depending upon that, then only we normally correct the situation, because the medication, whatever medications also we are giving, it will not immediately stop the symptoms. It will not immediately uh, completely cure the disease. It will just control the disease for that period of time. So we have to meet the pediatrician, developmental pediatrician, initially maybe twice a week, then slowly once in a week, once in a fortnight. And once the symptoms start subsidizing, or as we are controlling the symptoms, we have to keep on meeting the pediatricians regularly. So the other thing, and one more thing, that we have to treat the coexisting condition, as which I mentioned just 5 minutes back. So the behavior and psychological intervention is very important. The other one, medication. So in the medication, as I told you, there are two medications, stimulant and non-stimulant. So those medications, the methylphenidate and atomoxetine. So normally the doses are the same only, and the medications are given twice a day, before breakfast and before lunch. And according to the baby's controlling, how the baby is getting, symptoms are getting controlled, we have to increase the dose slowly. Slowly we have to increase, and we have to see for the side effects also. And if at all the one medication is, that stimulant medicine is not working, we have to give the another medication. If the baby is failing to get treatment from that another medication, or baby is having too many side effects of the first medication, the behavioral medication intervention is very important. Medications will control just the symptoms, but behavioral intervention is very important. In this, we are teaching the children and their families how to strengthen the positive child behavior. So we have to strengthen slowly the positive enforcement of the baby's behavior, and we have to eliminate or reduce the problem or unwanted behavior, the aggressive behavior or unwanted behavior, or else if the baby is very fighting continuously, he's going and poking the others, or he's just not sitting at one place. So we have to slowly make that baby, all the symptoms come down, which will reduce the, and then we have to, how we have to really give that behavioral therapy, which is like, because there are so many different things we have to monitor during this time, and we have to praise the baby during when the treatment is going, and we have to, so first thing, as I told you, parent training, this is very much effective method, because which reduces the conflict and improve the medication uses. Okay, whatever medication we are using, the use, it will come down slowly, so that behavioral therapy will help. So we have to set the clear rules and expectations. So whenever we are telling to the baby, do this, do that, we should not only tell that immediately, just keep on doing one thing, go and clean your room. So we have to tell him particularly and clean and quiet or else calm and kind voice that please put your shoes on the rack, put your books on the bookshelf, put your color pencils in the color pencil box. So we have to tell them slowly, slowly that one by one things, and that too not getting angry. We have to give them small instruction, small attainable goals. And once they do that job, we have to praise for them. We have to give them some reward. That is very important. And whatever time we are settling, so we have to put some rules and regulations, whatever the babies are following. Like these are good behavior, this is bad behavior. If you follow the good behavior, what you will get, and if you are following the bad behavior, what are the consequences? So we have to tell the kid that these are the consequences, and we should mentally prepare him to get it ready if at all if he does some negative. So there are so many, so that he'll be mentally ready and he's yes ready to accept that yes I have done some negative behavior, I have not behaved properly. So that is why Mama has given me this. Not we don't say that punishment, but Mama has given me this task so that baby will be happy to do that and he will be improved mentally to do that next job. So we have to give the clear instruction as I told you. So small instructions, and we have to have kind eye contact, and we have to not get angry by ourselves. We have to have our voice very kind, quiet, and calm. We have to give discipline, reward, and consequences. As I told you, we have to praise. We have to get them if they do some good job, good work. Slowly, we have to get them some special opportunities. We can take them out for a walk. We can take them out for enjoyment or to the children play area, or else we can have some special time out with the parents. But we should minimize the punishment, the consequences. As I told you, we should offer it and for the negative behavior and should tell them in advance so that they are ready to accept the negative behavior. And whatever consequences we are giving them, they should be fair, appropriate, consistent, and predictable. So it's not like that I'm telling one consequences for one bad behavior today, and if the child behaves the same behavior next time, I'm not telling that consequences. So it should not happen like this. The same behavior, if it repeats negative behavior, we should have that same consequences. Like he should have whatever task to be followed. Otherwise, we'll say, I have done this time. Mama has given me some task, some punishment, but now I have done the same thing. Mama has not given. So should I do that or should I not? So we have to follow the punishment properly. The consequences should be fair, predictable, and consistent. That is very important word. And we sometimes we can give time out if the child is not behaving at all. We have to give him time out. Like we should put him in some other room where nobody should talk to him, or else. But that time out should not be for more than, like if the 5 years old child is there, we can give for 5 minutes like that, so that he will understand that Mama is not talking to me because I have done something wrong. So that time out is sometimes very important. If the baby is very nagging, continuously arguing, continuously screaming, sometimes the mothers have to ignore that behavior. Because if baby is screaming, nagging, continuously arguing, and if mother is also or parents are also screaming on the top of that, that fight will continue, and then baby will not understand how to behave. So we have to ignore that. And till the time baby, sometimes they are getting bored with this. If the baby gets irritated with this ignoring behavior, then we should tell him that yes, till the time you are not stopping your screaming or else nagging or else arguing, I will not talk to you. So ignoring also sometimes helps in many ways. We have to define the schedule and routine, like get up at particular time, then you make your bed, go and brush your teeth, get ready for your school. After going to school, once he comes back, what are the schedule to be followed? Go to sleep, have lunch, again start homework, while going playing, how to behave. So we should set some schedule, so which will be very important for the kids to follow. And if at all, because that schedule, if they follow slowly, they will also understand. They will try to continue following that schedule. The other one is eliminate the distractions. So when you are allowing the baby, when you are given some task to the baby, you should tell them that yes, there should not be any distractions like some TV is on or video game is going on, or if somebody is talking, screaming, some function is going on. You should not do that. There should be some kind of quietness, or is the quiet place, or is baby should sit quietly and discuss that slowly, slowly. So, sorry. We should, as I told you, we should give small and attainable goals. So, which baby achieves, we should appreciate them, we should praise them, we should give them some reward so that they are more motivated to do the positive things next. The other one is we have to reduce the criticism. If the baby is continuously doing the same negative thing again and again, we don't have to continuously criticize, but you have to do it in some other way. The negative behavior of the parents should come down so that babies will not be continuously criticized again and again. And we have to last and not not least that we have to continuously show the unconditional love to the kids. So we should understand that yes, I am the important member of this family. My mama loves me, my papa loves me, my teachers loves me, so you always say I love you. You have done the very good job, that's very nice. I'm very happy for you, I'm very proud of you. So we have to keep on always praising the kid. That if you show them unconditional love, they are very happy, and the chances of improving, they are very, very good. So sometimes the dietary advice are also important, that we have to avoid the outside food, or else the preservative food, or else coloring agents we have to avoid. Sometimes normally for as I told you, and so if you want to some parents are telling that the hyperactive behavior is seen after eating particular food. So I would like to tell the parents also that we can maintain a diary. In that we can write it down. Okay, what all things if the baby has eaten, and after that the symptoms have worsened. So we can just avoid eating those particular things. So maintaining dietary chart is very much important thing, which can improve the symptoms of the baby. So till now we have seen what is ADHD, what are the symptoms, how to diagnose it, and how to give the medication, improving the medication, how to treat it, manage by medication, and the other one is behavioral therapy. So the most important is behavioral therapy. Parents should accept that the baby is having that particular symptom, and they should start the treatment as early as possible. So that involvement of the parents is the key factor for treatment of this ADHD. Because if the parents only accept and start doing this, it is the treatment will be as early as possible. And yes, I can understand that it is not completely getting cured, but yes, at least the symptoms are in control. So the final thing is the summary. I would like to tell you that the ADHD is highly prevalent brain-based disorder, which is associated with lifelong impairment in functioning and learning. Environmental factors which I told you, they can contribute to the expression, severity, course, and comorbid conditions. And the stimulant medication and the behavioral therapy is very useful for the management of ADHD. Thank you. So if anybody has any doubts, I would like to discuss with the doubts. Okay, so I can see some questions over there. So, what is the prognosis of ADHD? So, prognosis of ADHD, as I told you, slowly the symptoms. Once we start the medication, the symptoms are under control, and we have to continue the medication. We can increase the dose of medications also. The motor components, like the hyperactivity components, are in control, but sometimes slowly, this inattention and impulsivity behavior, it comes down slowly. It doesn't immediately change it, but yes, it requires the positive reinforcement and behavioral therapy. So sometimes the symptoms might continue for up to the puberty or adulthood life also. So what are the consequences of untreated ADHD? So as I told you, sometimes if the parents are not accepting the fact that my baby is having ADHD, it can persist in the adulthood also. And as I told you, the consequences that it can cause motor vehicular accident if the baby is not baby. If the that person is hyperactive, it can have motor vehicular accident, prone for injuries, some kind of relationship disturbances. Then baby, low self-esteem, and this legal difficulties. So normally, if we have to treat it as early as possible, whenever we get the chance, and whenever the doctor has diagnosed. Will ADHD in children will resolve itself by adulthood? So my answer is no. It will not resolve by itself because, as I told you, it is neurodevelopmental disorder. It will not immediately come down on its own. We have to start the treatment as early as possible. From the age of 4 years, we normally make the diagnosis. So once it starts, medications and behavioral therapy. And then behavioral therapy initially we give the intensive one, and then slowly we have to reduce that. And those are very small tasks which we give at home, so the parents can get it done at home. So which improves the baby's behavior, and that impulsivity and hyperactivity comes down. Parents who smoke during pregnancy increase the risk of having child with ADHD. It is true. Yes, I have told you during my first sessions that yes, baby is having, if those mothers who have history of cigarette smoking, or else alcohol use, consumption of alcohol, normally it can cause ADHD in the children. Childhood stress causes ADHD. Normally, no. Childhood, this one, late toxicity, like industry, if you're staying in industrial area and all. Okay, so exposure to the any certain environmental hazards that can cause ADHD, but not particularly childhood stress. What should we ask our doctor about our child's ADHD, and how should we prepare for our first visit? Yes, so good question. So what should we ask to the doctor? So normally, as I told you, so when the baby comes to the doctor, or else when the parents, normally the complaints comes from the school that baby is not sitting at one place, is continuously running around when the prayer is going on, or else one any activity is going on where he has to sit, he is not sitting there. In spite of that, instead of that, he'll go and poke other baby, or he'll go and bite some other kid, or he will go and dance in front of everybody, or he will go in front behind the teacher and he will poke the teacher also, and he doesn't feel neglected about that, or he doesn't feel guilty about that. That is very important. So normally the complaints will come from the school, and if the complaint comes from school, the parents normally come to us that does my baby has ADHD, because from the school we are getting many complaints, and yes, at home also baby is having can't sit at home. He is not listening to us. He is not doing any work at home. He is not doing his homework. He is continuously forgetting all the things whatever has taught in the school, and he doesn't sit at one place. So normally all these things occur starts from the age early childhood only. So once we go to school, it again gets precipitated, and normally that time the parents come to us, and that time we visit to the pediatrician, and we consult, and we do ask all the histories, whatever 9 questions I have asked now. So we normally ask them if it is falling into that category. Yes, we do consider it is as a ADHD. We don't want to medicate our child. Can we just do supplements? Yeah. So as I told you, giving the medication is not the cure. So if you don't want medication, and we can start the behavioral therapy, whatever I told you, there are 10 points which we take for the behavioral therapy. So slowly as we start the behavior therapy, babies might improve, and if this doesn't improve, like why we want medication, because the hyperactivity, the on the go, motor driven vehicle behavior, what I told you, that to reduce that, we have to use the medication, so that the baby stays at one place. He starts attending the classes slowly, and he will attend classes sitting at one place. He will start concentrating at the one part of the school at a time, so that he will not get distracted. So that is why we start the medication. So if you don't want medication, that's fine. But one point of time where we have to make the baby sit for long, which is not seen in ADHD kid, so that we require this medication. So what was the last question? Okay. So any other questions? If I would like to, if there is any other question, I would like to answer. That was my favorite topic, ADHD. So if anybody wants to ask anything, I'll be very happy to ask. Nice, thanks for asking these questions. I hope I had given some basic idea about ADHD. Those parents who are facing some issues about their kid hyperactivity and all. So if they have any doubt, anytime they can come. I'm working in Apollo Training Hospital, so they can come and discuss. We can go ahead and yes, find out some way to treat the people. Thank you.